Hey, my name is Jennifer Avens, and I am going to go over what to do with a foreign object in the eye. A little overview. A foreign object is something that does not belong in the eye, so anything not belonging in the eye. The injury may be superficial or penetrating, and it can cause conjunctival injuries. Some common objects found in the eye are glass, like from a car accident, metal grindings, BBs, dirt, dust, wood chips, insects, and fireworks. Some common complaints you'll have with someone that has a foreign body in the eye is going to be photophobia, foreign body sensation, or the inability to open their eye. A little fun fact from UpToDate, the World Health Organization's Blindness Data Bank notes that about 55 million eye injuries occur worldwide annually, and it results in 23 million individuals with at least unilaterally poor vision and about 750,000 hospitalizations. Some risk factors for foreign body in the eye are young males, improper use of protective eyewear, occupational hazards, and improper use of contact lenses. Some key questions that you want to ask your patients are what they were doing when they injured their eye. This could indicate a superficial versus penetrating, depending upon the speed at which the object entered the eye. You want to know if they know what the object is. This is important for the type of diagnostics and treatment. Organic matter has a higher potential for infection, and agricultural foreign body and improper contact lens use can cause keratitis. You also want to find out how long ago the injury occurred. This determines the course of treatment for any foreign body. The longer the object has been in the eye, the higher the rate for concurrent issues. With assessment of foreign object in the eye, you want to assess the visual acuity before any procedures and compare it to the patient's baseline. If the patient cannot use a Snellen chart, you want to assess using counting fingers, hand motion, or light perception. Next, you're going to inspect the entire eye for damage and additional foreign bodies. You're going to do the lid eversion to check for vertical corneal abrasions, and you're going to look for signs of perforating ovular injury, like irregularly shaped pupils, shallow anterior chambers, hyphema, which is blood in the interior chamber, and dark showing through the white sclera. You're also going to want to examine with a slit lamp and fluorescein staining to visualize foreign body and check for corneal defects. Treatment for a foreign body in the eye is you want to remove the foreign body within 24 hours if it's superficial. If it's on the bulbar conjunctiva or cornea, you're going to want to use a topical anesthetic and then remove with either irrigation or cotton-tipped applicator. If it's a penetrating eye wound, they're going to need to be referred to an ophthalmologist immediately. And before they leave their office, make sure you tell them that they do not need to eat or drink anything until they're seen by the ophthalmologist in case they need to have surgery. You're going to treat them for pain, either topical, oral, or IM. And once you remove the object, you're going to give them some prophylactic topical antibiotics. You've got erythromycin ointment and sulfacetamide drops, either or. The ointment is preferred because it also helps with lubricating the eye. You're going to do either one of these twice a day until the foreign body feeling is gone, and then the patient's asymptomatic for 24 hours. You want to give them a tetanus booster if it's a penetrating wound, and you're not going to use any corticosteroids because they may make a cozy home for bacteria or fungi growth and slow epithelial healing. Some education that you want to do is you want the patient to rest their eye. The eye patch is not a thing. According to UpToDate, there wasn't a lot of studies saying that it was a positive factor. So eye rest. It may take 1 to 2 days for the feeling of something in the eye to go away. You want them to use protective eyewear in the future, and do not use contact lenses until you release them to do so. And here you pause. There's a little chart that kind of gives you the steps of it. I thought it was a good chart.